Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes and metabolism. Question number 13. For the following case, which of the following tissues cannot use this energy source? A. Brain. B. Erythrocytes. C. Heart muscle. D. Renal cortex. E. Skeletal muscle. The case scenario is: a 24-year-old woman is admitted to the hospital with a diagnosis of acute appendicitis. She started having right lower quadrant abdominal pain approximately 30 hours earlier but did not go to the hospital because she thought the pain would subside on its own. The patient had no food, only sips of water, during that time. Blood pressure is 115/72 and pulse rate is 106 per minute. Mucous membranes are dry and there is tenderness in the right lower quadrant of the abdomen. Laboratory evaluation shows mild leukocytosis, normal serum electrolytes, borderline low serum glucose levels, and moderate ketones in the urine. Based on the evaluation, it is suspected that this patient is utilizing ketone bodies as a significant reserve of energy. The question is, which of the following tissues cannot use this energy source? Your options are A. Brain. B. Erythrocytes. C. Heart muscle. D. Renal cortex. E. Skeletal muscle. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is erythrocytes. This question is designed with the focus to assess your ability to apply foundational science concepts. After about 12 to 18 hours of fasting, the body's glycogen stores are depleted and gluconeogenesis is required to maintain blood glucose levels. As fasting continues, the body limits its reliance on gluconeogenesis in an effort to conserve protein and resorts instead to ketone body synthesis. Ketone bodies are generated in the liver from fatty acids and yield energy when converted to acetyl-CoA in the mitochondria of target cells. Erythrocytes cannot use ketone bodies for energy because they lack mitochondria. The liver is also unable to utilize ketone bodies for energy because it lacks the enzyme succinyl-CoA, acetoacetate-CoA transferase, or thiophorase, which is required to convert acetoacetate to acetoacetyl-CoA. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A, C, D, and E. Brain, heart muscle, renal cortex, and skeletal muscle can all utilize ketones for energy. In the initial stages of fasting, the heart and skeletal muscle consume primarily ketone bodies to preserve glucose for the brain, but in prolonged starvation, even the brain will utilize ketone bodies for the majority of its energy needs. Your take-home message from this question is that when glycogen stores are depleted during fasting, ketone bodies are produced in the liver and can be used as an energy source in the mitochondria of peripheral tissues. The brain preferentially uses glucose, but will utilize ketones for most of its energy needs during prolonged starvation. Erythrocytes lack mitochondria and are unable to use ketones. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.